And joining us now on the line from Winnipeg, Manitoba, Tracy Macchia. She has multiple sclerosis, and she recently underwent something called liberation therapy in Bangalore, India. And Tracy, we're glad you could spare some time for us tonight. How's things in the Peg?
Actually, it's a lovely day today.
Glad to hear it. Let's get, and first of all, I guess we should say, I really appreciate you coming on telling us about this. This stuff is very newsworthy, and I guess we're going to be sort of invading your privacy a little bit here, but you've been a good sport to help us out here so we can better understand this. How did you personally find out that you had MS?
I was diagnosed when I was 19, just a pinky that started losing feeling, and went to a neurologist. And back in 1980 or 81, they didn't have MRIs, so they just sort of had to rule out any possibilities of anything else. And when it didn't come back as cancer or brain tumor, then they just deduced that it must be MS then.
Did you know what MS was?
Hadn't a clue. The only reference I had wrongly was MD, muscular dystrophy. But I educated myself, and then the reality hit.
Okay, so I think everybody's heard of it, but I'm not sure everybody knows exactly what it is. So give us your best definition of what multiple sclerosis is.
It's insidious. It is very slow, or in my case, very slow acting, and takes little bits of your capabilities. Now I am just on a really slow decline, and that's been going on for 10, 20 years now.
So from where you were at the age of 19 to where you are right now, I don't know if you can put a number on it or a percentage, but how much would you say your natural abilities have been downgraded over the years because of this insidious condition?
I would probably say, I've never actually put it into numbers, maybe 70%.
So you've lost 70% of whatever physical, mental, sight abilities that you may have had at 19?
Yeah, absolutely, yes.
Well, Tracy, as we said earlier, you just got back from India where you underwent this liberation therapy, and I want to read something here that Ann Kingston wrote in Maclean's magazine earlier this year that describes the difference in Dr. Paolo Zamboni, the Italian doctor's theory. Here's what Ann Kingston writes. Zamboni's findings, published in August 2009, point to the disease having its roots in the vascular system. When studying the ultrasounds and MRI results of MS patients, he discovered that virtually all showed a blockage or a narrowing of veins leading from the brain. Such blockages, he posited, could cause blood to flow back to the brain, resulting in toxic iron deposits that in turn could trigger MS symptoms. When he cleared the veins using a balloon angioplasty, Zamboni witnessed remarkable transformations. Those in the early stage of the disease had a full recovery. Those with severe disabilities showed marked improvement, more energy, renewed sensation, and movement in hands and legs, and improved vision. Okay, let's unpack this a bit and find out how it's worked in your experience. First of all, how'd you hear about liberation therapy?
I was just watching, I was told to watch a news program on TV, and we sat down and we watched it, and theoretically it just made so much sense. And from there, watching this news program and the anecdotes that were reported about the benefits of getting this liberation treatment, then I started to go on the internet and start asking questions, talking to the MS Society of Canada, then going to the MS Society of America.
What did they say?
Well, the MS Society of Canada really was not, really wasn't an advocate of this liberation treatment.
They're not believers.
They felt, no, absolutely not. And feeling that I wasn't getting anywhere with MS Canada, then I went down to the States to see if maybe they were having opportunities to for the exploratory, the MRVs.
What was their reaction down there?
Oh, and they more or less were status quo with the MS Society of Canada.
How about your family doctor in Winnipeg?
Oh, you know what, Dr. Hauck has been absolutely wonderful. She has stood behind me, and she was the one that suggested India. She said that that medically, technology in India can sometimes surpass even North America.
Well, let me jump in there for a second, because you, obviously you've read the papers, you know how controversial this whole thing is. Was there any doubt in your mind about whether or not you ought to pursue this avenue?
Absolutely, well, that's a lie. I was hesitant, but through the support of my family, they said, you know, how can you not? Obviously, we're not going to be able to pursue this in Canada. Then we've got to go elsewhere, obviously.
Okay, so you're talking about a plane ticket over to India. You're talking about the costs associated over there. Obviously, OHIP is not paying for this. What's the damage on this?
All told, but my husband and myself, we were in the hospital for 5 to 6 days in India, and then recuperating in a hotel in India, and it probably cost us about $18,000.
How much? Say again?
18.
18,000. What did you expect when you went over to India and were about to undergo the treatment?
I think that's probably the biggest difficulty. Is I really had no expectations. I wouldn't allow myself to have any expectations. Just afraid that my hopes would be dashed. It was a real culture shock. It was very interesting to go so far away and to undergo something where you feel so vulnerable because you don't speak the language, and you're sort of at the mercy of these people.
Can you pursue that for us a little bit? What kind of comparisons would you make between you know, a medical procedure you might have had here in Canada versus one over there?
A huge difference, a huge difference. The Indian people themselves are so accommodating and wonderful, but when I was in the hospital, the nurses didn't wear gloves. There didn't seem to be the concern about the different steps that we do here in North America in regards to making sure you glove up every time you take blood. And like I said, the language barrier was very difficult.
Do you remember anything about the operation?
Oh, I remember everything.
You do? Tell us what you remember that they did to you.
Well, you don't get general anesthetic. You do get freezing in the groin where the catheter is inserted. It didn't get uncomfortable until such time as I could actually feel them rooting around in my skull. And I could tell that they were looking at the right side vein, and then I could tell they were going onto the left side. And I remember laying on the table and feeling a little uncomfortable and thinking, why do I have to be awake for this? But they would need to instruct me to take deep breaths in and out. I guess they were checking to see how freely the blood was flowing on each side. And that's when they decided that, or they told myself and my husband that I was 30% blocked on the right side and 75% blocked on the left side. And the left side was sort of crimped like a corkscrew. And they attempted to, they did use a balloon to open the right side, but they couldn't establish free-flowing blood to the left. So they actually had to implement a cutting tool that they used on the left-hand side, and they ended up opening it up and then inserting a stent.
Right. Any pain during the procedure?
Absolutely. There was a lot of, not so much the right side where they just did the straight angioplasty where they opened it up with the balloon. There was pressure, but I certainly wouldn't call it pain. But when they had to end up opening up the corkscrewed vein on the left-hand side, where they used the cutting implement, that was most uncomfortable, and it actually felt like they were going to come out my eye.
Oof.
But
maybe this next question is dumb and obvious, but what the heck? Let me ask it anyway. Scared out of your mind during the thing?
You know what? There was just too much going on. there was 2 surgeons in the operating room, and both surgeons received cell phone calls while they were doing the procedure, which I thought was a little peculiar. But and when something like that's going on, you're really not thinking about fear necessarily, as just how odd it is.
Did they take the phone calls in the middle of your procedure? They
Yeah,
did.
they did.
Oh my gosh.
I don't know what they were speaking about, because they were speaking Indian. But
Tracy, tell me this. Have you noticed any difference in yourself since you underwent the procedure?
I absolutely have. They're very small differences, and only I would necessarily notice them. And they're so simple, but they're huge to me. They're like my little gifts.
Like what?
When I get out of the tub, I can actually remain standing and put my hair in a towel and continue on with my with what I'm doing. Where before I would have to look around and either sit on the edge of the tub or sit on the toilet.
So you have some balance now you didn't have.
Not so much balance, strength in my legs, to be able to maintain standing. I could never do that before.
Okay, and have they told you what you can you expect more improvements as the months go forward?
Dr. Rahim, the surgeon, definitely said that this is a slow process. I was not one of the fortunate ones that jumped up off the operating table and yelled Eureka and danced down the hall. But he did say that over the course of time, I will slowly be able to notice more and more improvements, just because, I mean, I've had this for 30 years. So for 30 years, my muscles have been slowly atrophying. So once I get back into physio, I'm back doing my yoga. So I'm hoping that incrementally it'll all come back. I certainly don't expect that, but I'll be able to slowly regain more and more of my strength.
And there's no question in your mind that you feel better because of this procedure?
Absolutely, absolutely. I'm sure somebody, some lay person on the street would look at me and think, you know what, you're in trouble. But daily, I notice more and more little things that are just the quality of my life has improved, because I'm able to feel a little less fatigued. I can do a little bit more every day.
Well, Tracy, let me ask you one last thing, and before I do, I want to read something that the Globe and Mail published in early September, because you know this is all wrapped up in politics now here in Canada. This is a very controversial issue. August 31st, the Canadian Institute of Health Research and the MS Society of Canada released a joint report on Dr. Zamboni's research. And what did the report conclude? That Dr. Zamboni's research has numerous methodological flaws and should be viewed as a pilot study at best. That the liberation treatment involves an intervention, venous angioplasty, that is potentially dangerous and could lead to stroke and heart complications. And perhaps most importantly, that there's little support for the notion that venous insufficiency for the brain or spinal cord contributes to the development of MS. And then the day after that report came out, the federal health minister, Leona Aglukkaq, said the Canadian government was not going to devote any money to the clinical trials right now. But of course, you know, in Saskatchewan, Newfoundland, and Labrador, they have decided as provinces to go forward. So the question is, what do you say to those who think that what you underwent was closer to quackery than miracle, and that we should not be in the business of funding it?
I say bully to those premiers that in Saskatchewan and in the Maritimes, that they're willing to take a look at it, and sure, if it's a study, that's fine, but allow people that want to undergo this treatment to have the chance and study the heck out of them.
Tracy, as I suggested at the outset, it's awfully good of you to share some of your time with us tonight here on TVO and help us understand something that's been much discussed in the news lately, and we obviously all wish you very well in your future health recovery. Take good care, and thanks for joining us tonight on TV.
Thank you so much.